Hello everybody, this is Dr. Omid, and in this video I'm going to talk about the second part of the gastrointestinal tract or digestive system, and in this video I'm going to talk about the salivary glands and pharynx and also esophagus. Hopefully this video it will be useful for your studies. Next part of the digestive system is salivary glands. Salivary glands, they are producing saliva. The saliva, it has a function as a lubrication of the food and mucous membrane of the oral cavity, and it's facilitating of the swallowing of the food that you are eating. Also moisturizing the mucous membrane, the surface of the mucous membrane and the papilla of the tongue. And also saliva contains the enzyme which is called petiolin for the digestion, the beginning of the digestion of the starch. So salivary glands we are dividing to two main groups. One group is they are called minor salivary gland, and there are 5 groups of the minor salivary glands, that they are the glands that they are located in the mucous membrane or submucosal layer, and they have the structure as a tubo-alveolar structure. Their production is permanent almost, so for the production they don't need nerve stimuli, and permanently they are producing saliva. The groups of the minor salivary glands, they are according to their location. We have 5 groups. They are located on lips, that's why they call it labial glands. They are located in palate, they call palatine glands. They are located in cheeks, that's why they call it buccal glands. And they are located on the tongue, as we mentioned it, near to the valate papilla. We have the Ebner's glands, that they are serous, they have the secretion, serous secretion. And at the root of the tongue, behind the sulcus terminalis, we have the Weber glands, that they are mainly mucus secretion they have. And also under the tip of the tongue is the anteriolingual gland, which is, or the apical lingual gland, that they are the seromucinous, is a mixture secretion they have, and is the biggest or largest minor salivary glands. And the last group, so those are the lingual glands, and the last group, there are the groups of the glands that they are located at the behind the last molar, at the retromolar trigone, and they are called like molar glands or retromolar glands. So altogether, we have labial, we have buccal, we have palatine, we have lingual, and we have molars or retromolars, minor salivary glands, that they are permanently producing the saliva. The content of the saliva can be serous, pure serous, or it can be pure mucinous, or it can be mixture of both of them. Then we have the major salivary gland, that in this picture you can see. The major salivary glands, there are 3 paired salivary glands: the parotid gland, the submandibular gland, and the sublingual gland. The parotid, so those major salivary glands, they have one single duct, as you see here or here, and they are carrying the saliva to the oral cavity, either to the oral cavity proper, like a salivary gland and sublingual, like a submandibular gland and sublingual gland, or to the oral vestibule, like a parotid gland that we are going to discuss. The major salivary gland, they are producing the saliva under the nerve stimuli. So after the nerve stimuli, the secretion is increasing mainly by parasympathetic innervation that we are going to discuss in the nervous system. And parasympathetic, in this case, they are stimuli that are increasing the secretion of the salivary gland, and sympathetic vice versa. So the first gland, the major salivary gland that you can see here, and the continuation of this parotid gland, it's going to the inner surface of the mandible, behind the mandible, and it reaches to the inner surface of the mandible. It's called parotid gland. It's approximately triangular shaped. Superiorly, it has two parts. One part that it's located on masseter muscle, on dorsal surface of the masseter muscle, is called the superficial part that superiorly is reached to the zygomatic arch, and posteriorly it can reach to the auricle and near to the neck of the mandible, and sometimes it reaches to the condylar process of the mandible, and the cartilaginous part of the external acoustic meatus it reach. And we have the deepest part or deep part of the gland, the parotid gland, which is a larger part of the parotid gland. And as you see, this parotid gland is turning behind the dorsal and the outer surface of the ramus of the mandible, and it's turning and it goes inner to the inner part of the ramus of the mandible, and it reaches to the styloid septum, the muscles of the styloid septum, and nearby the medial pterygoid muscle that it's located here and is attached to the medial, the pterygoid tuberosity in inner surface of the angle of the mandible. So this is the location of this gland. This gland is covered by the fascia, which has several parts. The part of the fascia which is covering the gland is called parotid fascia. The parotid fascia, it's covering the superficial part of the parotid gland, and the part of this fascia that is covering also and is sending a deep septum to the masseter muscle, and also is covering the masseter muscle, is called parotidomasseteric fascia. Is called. And this deep part of the parotidomasseteric fascia, it reaches inside and it's covering the gland and separating the gland from the styloid septum muscle, like a stylohyoid and a styloglossal and a stylopharyngeal muscle, and the posterior belly of digastric. So this is separated, and separating it from the medial pterygoid muscle. One important thing about the parotidomasseteric fascia in caudal direction near to the angle of the mandible, here in this region, this fascia, it's continue as a investing layer of the cervical fascia, and at the level of the angle of the mandible it's become very thick, which is called angular tract or tractus angularis here. And it's important clinically that is separating the parotidomasseteric region from the submandibular region. So the transmitting of the infection from these two places, it's practically very difficult and almost impossible. So the tractus angularis or angular tract is the thickness of the parotidomasseteric fascia, which is continued to the investing fascia of the neck or investing layer of the cervical fascia, and it's separating the parotid place from the submandibular place. So that is about the position and the covering of the parotid gland. Parotid gland has a secretion which is pure serous secretion they have. So they are producing almost pure serous saliva, and this saliva is carried by this duct which is called parotid duct or stenos duct. So this duct is passing or is starting from the deeper part of the parotid gland, and it's passing over the masseter muscle, and after the passing over the masseter muscle is piercing the buccinator muscle, and it's open to the oral vestibule opposite to the upper second molar. If you look at the cheek, the mucous membrane of the cheek, opposite to the upper second molar, you can see a small papilla that is called parotid papilla, and this is the place of the orifice of the parotid duct. At the passage of this parotid duct, sometimes you can find accessory parotid gland that it's located in the pathway of the parotid duct. The parotid duct approximately has 5 centimeter. Of course, is individually is variable, but generally is 5 centimeter is the length, and approximately it's 2 millimeter the diameter of this duct, or 2 or till it can be variable till 4 millimeter also. The secretion we said, and it's a pure serous, and it's in the oral vestibule or vestibulum oris. So this is the parotid gland. So what is important for the parotid gland, that is between the smaller portion of the parotid gland, which is called superficial portion, and the bigger, deeper portion of the parotid gland, it passes a very important nerve which is called facial nerve. The facial nerve is entering to the parotid gland and is dividing the parotid gland to 2 portions, the superficial portion and deep portion. So the border between the superficial and deep part of the parotid gland, they pass the facial nerve, and facial nerve inside the parotid gland, it's divided, and it's making a plexus which is called parotid plexus, or sometimes it's called intraparotid plexus. And from this intraparotid plexus is sending branches, the motoric branches, as if that when you put your finger or your hand in the place of the parotid or masseteric region, you can see that it gives the 5 motoric branch of the facial nerve for innervation of the mimic muscle or muscles of the facial expression, as a temporal, as a zygomatic, as a buccal, as a marginal mandibular, and as a cervical or colli branch that in the nervous system we are going to discuss. Then another salivary gland is submandibular gland. The submandibular gland is located at the submandibular triangle or submandibular region, and it's located under the mylohyoid muscle. So here, as if you remember, here we had the mylohyoid line is the place for the attachment of the mylohyoid muscle, and here in the posterior and under the mylohyoid line and posteriorly in the inner surface of the mandible, you had the submandibular fovea, the depression of the mandible, and here is the place for the location of the submandibular gland. The submandibular gland also it has some extension or process which is called anterior process of the submandibular gland, that is turning posteriorly, and it reach to the sublingual space under the tongue. So it means that it's turning around the posterior margin of the mylohyoid muscle, and it reached to the sublingual region. And from this part, it's sending its duct, which is called submandibular duct or Wharton's duct. And this duct also is approximately 5 centimeter, and the diameter is approximately 1 till 2 millimeter, is smaller. Finally, as we mentioned it before, in the tongue section, it's open on the either side of the lingual frenulum, which is called sublingual caruncle. It's the place for the opening of the submandibular duct, together with the major sublingual duct that we are going to discuss. Submandibular duct is submandibular gland. The secretion is mixed secretion. It means seromucinose secretion we have, but the majority is producing the serose secretion. But generally is a mixed gland. This is the submandibular gland, and this duct of the submandibular gland or Wharton's duct is crossed in the sublingual region by the very important nerve, which is called lingual nerve that we are going to discuss. And finally, we have the sublingual gland. Sublingual gland, it's located, as we mentioned it before, in the skull, above the mylohyoid line. It means that above the mylohyoid muscle, and in the region of the sublingual fovea, there is a place. There is a small gland which is called sublingual gland. This sublingual gland, it has anterior portion. It's also is a mixed gland, but mainly is the production is the mucinose secretion of the saliva. It means that the anterior part is secreting the serose secretion, and the posterior part is secreting mainly the mucus secretion. The sublingual gland, which is located under the tongue in the sublingual fovea of the mandible, it has two types of the duct. One duct which is open the same as the submandibular duct at the sublingual caruncle. It's called major sublingual duct. And as you see here, there are several minor sublingual ducts that they are open to the place which is called sublingual folds. And those are the two different openings. One opening for the major sublingual duct, which is open together with the submandibular duct at the sublingual caruncle, and the others, they are the minor sublingual ducts that they are open to the sublingual fold. Here in this picture, you can see the anterior process of the submandibular gland, that it's turning at the posterior margin of the mylohyoid muscle, and it reached to the space which is called sublingual space, and from this place it's sending its duct, which is called submandibular duct or Wharton's duct, to the place which is called sublingual caruncle here. Here, as I mentioned, is very important for the surgeon when they are doing some surgery here. The relation of the submandibular duct in sublingual space with this nerve, which is called the lingual nerve. Lingual nerve, as you see in sublingual space or sublingual region, it's crossing the submandibular duct, and it goes under the submandibular duct. Here, as you see, the mylohyoid muscle, and above the mylohyoid muscle, definitely you can see the sublingual gland with its major sublingual duct, which is open to the caruncle, sublingual caruncle, and several minor salivary glands, salivary ducts or minor sublingual ducts, that they are open to the sublingual fold or pellica sublingualis, that here on the floor of the mouth it's seen. Just a very short revision of the innervation of the salivary gland. As I mentioned, the parasympathetic, which is a part of autonomic nervous system, it's responsible for the increasing the secretion of the salivary gland. For the parotid gland, the parasympathetic ganglion that is responsible for innervation of the parotid gland is the otic ganglion, and the parasympathetic fiber is receiving from the branches of the glossopharyngeal nerve. And the parasympathetic innervation for the submandibular and sublingual glands, it's submandibular ganglion, and the parasympathetic portion it's received by the branches of the branch of the fascial nerve, respectively the chorda tympani is responsible for innervation of parasympathetic innervation and the secretomotor innervation of these two salivary glands, submandibular and sublingual glands. Regarding the major salivary glands, this is the area of the parotid gland. As you see here, it's almost triangular shape. Here, cranial border, which is toward the zygomatic arch. Here is the masseter muscle, as you see, and the superficial part of the gland, it's located on posterior part of the masseter muscle here. And then whatever we going posteriorly toward the behind the ramus of the mandible, and here in this region is going the deep part of the parotid gland, that these two parts are divided by the passage of the fascial nerve that we said that the inside the gland it make the intraparotid plexus or parotid plexus. So here you can see posteriorly is near to the auricle and till the neck of the mandible and the head of the mandible, and here the posterior border of the ramus of the mandible is turning inside, and inside it goes and continue to the muscles of the styloid process or the styloid septum until the medial pterygoid muscle. Here it's very important and a nice structure that you can see the parotid duct. The parotid duct it's coming from the anterior part of the parotid gland and is running over the masseter muscle, as you see, and then it's turning deep and it's going to the buccinator muscle, which is perforating and piercing the buccinator muscle, and in the oral vestibule or the vestibulum oris in front of the upper second molar is open the parotid duct as a parotid papilla during or the according to the pathway of the parotid gland. On the pathway sometimes you can see this structure, which is the accessory parotid gland that in the way of the parotid duct, which is running in this area. It is located. Then here you can see the submandibular gland. As you see, here is the inferior border of the body of the mandible. Here is the angle of the mandible with the insertion of the masseter muscle, and here is the inferior border of the body of the mandible, and under that here is the submandibular gland. Here you can see the anterior belly of the digastric, and here you can see the mylohyoid muscle, which is separating the neck region from the sublingual region and oral cavity. Very important topographical relation of the submandibular gland is this is the fascial vein, and this is the fascial artery. The fascial vein, which is usually located posteriorly, and the fascial artery is anteriorly. This is one difference. Second difference, that the fascial vein is passing straight, and the fascial artery is passing wavy shape or zigzag shape. The other difference that it's important when you are going to operate the submandibular gland is that the fascial vein is located superficial to the submandibular gland, but as you see the fascial artery, it's deep to the gland, either is inside the material of the gland and then it's coming toward the body of the mandible, or behind the or dorsally and deep to the submandibular gland. This is the important difference. So first, when we are cutting the skin and subcutaneous connective tissue and the superficial fascia, and we cut the platysma, and then we reach to the investing layer of the cervical fascia. Under that, then you can see the fascial vein, that you have to ligate the fascial vein and put it away and reach to the submandibular gland. And then when you are going deep to the submandibular gland, then it's the fascial artery. But both of them, it's coming, these two vessels is coming at the body of the mandible in front of the anterior margin of the masseter muscle. So here you can put your finger and you can feel the pulsation of the fascial artery here in this area, and in the case of the bleeding of the face, you can press and you can stop or diminish the amount of the bleeding in the fascial region. So once more, here is the zygomatic muscle, mimic muscle, here is the buccinator muscle, here is the masseter muscle, here is the digastric muscle, anterior belly, which is passing and attaching to the digastric fossa, and here is the mylohyoid muscle. And this is about this preparation. And if I go this submandibular gland, and I go from the other side, from the inner surface of the mandible to look, I can show you this preparation, which is very nice preparation and difficult preparation. Here you can see the continuation of the submandibular gland, that it's passing behind the posterior margin of the mylohyoid muscle, and it's entering to the sublingual region. From here, it's starting the submandibular duct, which is here, and here it's continue, and it's end up here at the sublingual caruncle. It's the opening of the submandibular duct. So here it's the submandibular duct, and here is the continuation of the submandibular duct. As I mentioned, the submandibular duct is crossed. Here is cutted, the submandibular duct, that as you see, it's cutted by this nerve, which is called the lingual nerve. The lingual nerve is passing and is crossing under the submandibular duct. So the submandibular duct, the correct pathway is like this, and the lingual nerve, which is here, it's crossing the submandibular duct, and it's going under the submandibular duct, and it's going to the anterior two-thirds of the tongue for the sensitive innervation of the tongue. And finally, here, above the mylohyoid muscle, you can see the sublingual gland. Sublingual gland is much more anteriorly located and superficially is located. Here is the teeth, and here is the alveolar process for your orientation. And here in this area at the floor of the mouth, you can see the sublingual fold, which are opening of the minor sublingual ducts, that they are opening it here. And one of them, which is the major sublingual duct, is open together with the submandibular duct at this region, which is the sublingual caruncle. So this is the sublingual region, and to a structure or some structure of the sublingual space, which are the sublingual gland, the anterior process of the submandibular gland that is inter to the sublingual part. Here is sending the submandibular duct, which is crossed and by the lingual nerve, and it goes under that in sublingual region, and in the floor of the mouth here it's passing the hypoglossal nerve together with the vena comitans nervi hypoglossy, or vein accompanied with the hypoglossal nerve here in the floor of the mouth is passing. Here is the tongue, here is the lower lip, and here is the upper lip. Here is the alveolar process of the mandible, and here is the hard palate. This is for your orientation. And finally, in next preparation that I'm going to show you here, the parotid gland is dissected, and in the parotid gland, when it's dissected, you can see this whitish fiber that they are passing. Those are the branch of the facial nerve, which is coming from the parotid plexus or intraparotid plexus. And according to their direction, we have 5 branches that we mentioned. It's the temporal branch, it's the zygomatic branches, this is the buccal branches, and here is the marginal mandibular branches, and here is the cervical branches, which is going downward to the neck region. Be careful not to do mistake with this structure, and this structure is the parotid duct, which is going over the masseter muscle, is piercing the buccinator muscle here, and it open to the oral vestibule opposite to this upper second molar at the vestibulum oris or oral vestibules. So here all about the major salivary glands, the minor salivary glands that we already mentioned it in theory. We have 5 groups that they are located in the lip region, cheek region, palate, retromolar region, and tongue region that already is discussed. Here is another preparation for the major salivary gland. So here is the part of the parotid gland that you see. Here is the parotid duct. Here is nice showing how the parotid duct is perforating is going over the masseter muscle and perforating the buccinator or buccinator muscle. Here is the submandibular gland that is dissected, and when I go deep to the medial border and is turning over the posterior margin of the mylohyoid muscle, I can show it to you here. This is the tongue, and I am now in the other side. This is this preparation that you can see. It's starting here and going up forward. This preparation is the submandibular duct or Wharton's duct, which is open here both in the side of the frenulum, lingual frenulum, and its sublingual caruncle. So here and under that, as we mentioned it here, fortunately is not cut. So here under that is crossing it by lingual nerve. So here is the lingual nerve that is crossing, and it goes under the submandibular duct. So this is the nice preparation that I wanted to show you. Next part of the digestive tract is pharynx. Pharynx is an organ which the length is approximately 12 till 15 centimeter. Is started from the cranially is started from the base of the external base of the skull, the place that the pharynx is attaching to the external cranial base, which is called the pharyngeal fornix, and we are going to discuss the place. And caudally, it's the pharynx is finishing at the level of the cricoid cartilage, and which is at the level of C6, and it is continue as a esophagus. The largest diameter of the pharynx is approximately is 4 till 5 centimeter in the widest part of the pharynx. Pharynx, we divide them to three main parts: the nasal part, which is called nasopharynx; the oral part, which is called oropharynx; and the laryngeal part, which is called laryngopharynx. So here you can see the nasopharynx, and here you can see the oropharynx, and here you can see the laryngopharynx. The nasopharynx. The nasopharynx is the widest part of more or less the widest part of the larynx, and it's cranially it's attaching to the base of the skull. Very important, the communication is. The nasopharynx is communicating with the nasal cavity through this opening, which is called Juane. Juane, it's the opening, which is the nasal cavity is communicating with the nasopharynx, and it's separated and is divided to the left and right by the nasal septum, mainly the vomer, which is dividing the Juane to the left and right. So the communication of the nasopharynx to the nasal cavity is this opening, which is called Juane. Then the communication of the oropharynx with the oral cavity, it's this opening which is called isthmus of Faucium. Isthmus of Faucium, it's the place that the oral cavity proper is communicating with the oropharynx. And finally here it's the laryngopharynx, and laryngopharynx is communicating with the larynx through this opening, which is called laryngeal inlet or additus laryngeus, that we were discussed in the respiratory tract in larynx section. So those are the communication of the different part of the larynx with the neighborhood structure. The nasopharynx, that here it's appear as a green color, is starting from the external cranial base till the C2. It means the axis vertebra. It's this level. And to the nasopharynx, not only we have these two openings, which we said that is called Juane, but also the eustachian tube or auditory tube. Also, it's located inside it open inside the nasopharynx, which is called the ostium pharyngeum of the eustachian tube or pharyngeal orifice of the auditory tube here, and it has very important function to equalize the pressure between outside of the the middle ear and the pressure in the atmosphere. So you have experience if you sit in airplane, and if the plane is going up, suddenly you see some pressure in your ear, and this is because that the pressure between the middle ear and atmosphere is not equalized, and if you swallow or if you have chewing gum, by swallowing by continuation of the swallowing, so you are opening, as we mentioned, in the muscles of the soft palate, mainly the tensor veli palatini, which is the dilator of the tube. In most of the literature it was mentioned. It's open the pharyngeal opening of the eustachian tube in nasopharynx, and regulating the pressure between the middle ear and atmosphere. And in this case, you release this pressure of your ear. Then another structure that you can find in the pharynx is the pharyngeal tonsil. We already mentioned about that. That is a part of the valvular ring or tonsillar ring, that in children, usually the pharyngeal tonsil it will be is enlarged, and by the age, by the growing of the child, so this pharyngeal tonsil is the size is diminished. And also around the opening of the auditory tube, there is a cartilage which is called torus tubarius. This is the place that the cartilaginous part of the eustachian tube is located, and this elevation is called the torus tubarius in the nasopharynx. And behind this place also there are the accumulation of the lymphatic tissue, which is called tubal tonsils, which are also a component of the valvular rings or the tonsillar rings. So in this case, in the oronasal area, we have lingual tonsils, we have palatine tonsils, we have pharyngeal tonsils, and we have tubal tonsils that all together they are making the valvular rings or the tonsillar ring. Then we have the oral part of the pharynx, which is called oropharynx. As we mentioned, it is communicating with the oral cavity through this opening, which is called isthmus of Faucium. The opening of this isthmus Faucium is regulated by the two muscles that is palatopharyngeal and palatoglussal muscle that we already mentioned it for the muscles of the soft palate. The level of the oropharynx is approximately between C2 till C4. And after that, the caudal continuation of this oropharynx is the laryngeal part of the pharynx, which is called laryngopharynx, and it's approximately from the level of the C4, it's continued till the level of C6, which is the cricoid cartilage. So the communication of the laryngopharynx, as we said, to the larynx is additus laryngeus, or the laryngeal inlet, which is the entrance to the larynx. It is, and also in this region, in the both sides of the larynx, there is a blind depression that I'm going to show you in the next picture. So this is the picture that I wanted to show you. This place. This place is located in the both sides of the laryngeal inlet or additus laryngeus. Here there is a blind recesses in both sides. It means that the lateral border of this recess is called piriformis recess. Laterally is bordered by the fold, which is called ariepiglottic fold. We already mentioned it in the larynx section, and this is the medial border, and the lateral border and superior border is bordered by this fold, which is called the pharyngoepiglottic fold. And this is the place that when you are eating the food, so here you have the isthmus Faucium, and the food when is swallowed, so here the laryngeal inlet is closed, and the food it goes to the laryngopharynx and it continues to the esophagus here. And if you have experience, for example, if you are eating fish, the fish bone is usually trapped in this region, the recessus piriformis or piriformis recess. Those are the usual place that the foreign body can trapped here in the pharynx, the laryngopharynx, and this is important. Lateral to that it's the place that a little bit it's elevated, and it's the place that it's passing the internal branch of the superior laryngeal nerve, which is called the laryngeal fold for the or the fold for the laryngeal nerve. Cranial extension of the pharynx, as we said, that is attached to the external cranial base, is called pharyngeal fornix. This green line that you see in this picture, it's determining the place of the attachment of the pharynx cranially to the external cranial base, which is called fornix pharyngis or the pharyngeal fornix. This attachment is started from the here from occipital bone, which is called pharyngeal tubercle, and then it's continue laterally to this place, which is called the petrooccipital synchondrosis, and then ventromedially is continue in front of the carotid canal, and it's passing the synchondrosis sphenopetrosus or sphenopetrosal synchondrosis, and then it's parallel with the medial pterygoid medial plate of the pterygoid process is going here. So here, if I want to show you in the skull, so here you have the pharyngeal tubercle, and laterally it goes to the petrooccipital synchondrosis. This is petrosal bone, and here is the occipital bone. So here is the occipital synchondrosis. Then ventromedially it's continue in front of the carotid canal. Here is the carotid canal. It's continue toward, and it passing the synchondrosis sphenopetrosus or sphenopetrosus synchondrosis, and then it goes parallel with the medial plate of the pterygoid process. Here is the medial plate, and here is the lateral plate. So here, then this attachment is continue to the bucopharyngeal raphe, which is the border between the buccal region and pharyngeal region. It is, and then it continue with the mylohyoid line. It's the place of the attachment of the mandible. So this is the outline of the attachment of the pharynx in this area that we mentioned it, and here is determined. It's called the pharyngeal fornix, and the base of this pharyngeal fornix is composed of the connective tissue, which is called pharyngo-basilar fascia. It doesn't have this cranial part of the pharynx. It doesn't have any muscle fiber. It's just pure connective tissue, which is called the pharyngo-basilar fascia, and attachment to the external cranial base is the pharyngeal tonsil that we mentioned. Regarding the structures of the pharynx, as we discussed it before, the general structure of the gastrointestinal tract, we have 4 layers. The inner layer is the tunica mucosa or mucosal layer, that it contains epithel. In the case of the pharynx, the epithelium in the region of the nasopharynx is cylindrical epithel, is similar to the respiratory epithelium of the nasal cavity. And the other part of the pharynx, the epithel, is the squamous epithel. Then after the mucosal layer, which contains the glands inside the mucosal layer and submucosal layer, that they are called pharyngeal glands, that they are secreting the secretion. And it's the submucosal layer which is the connective tissue, and this submucosal layer is attaching to the pharyngo-basilar fascia that we already discussed. Then we are reaching to the muscular layer that you see in this picture. The muscular layer of the pharynx, we divide them to 2 groups of the muscles. One group is called constrictor muscles of the pharynx, according to their name. Its name is the function is the contraction of the pharynx and narrowing the diameter of the pharynx during the swallowing. And the other groups of the muscles, they are elevator muscles of the pharynx, and according to its name, their function is elevation of the pharynx is. And the last part of the pharynx, or the last outer layer of the pharynx, is adventitia, which is the connective tissue, is covering the outermost layer of the pharynx. So, in this picture, I'm going to discuss about the constrictor muscles of the pharynx. As you see, we have three colors: the upper, middle, and lower constrictor. So it means the superior and middle and inferior constrictor muscles of the pharynx, that they are overlapping each other. So it's not that they finish edge to edge and they start the other muscle, but they are overlapping each other, the constrictor muscles of the pharynx. According to their origin, each constrictor muscle of the pharynx, we divide them to different parts. The superior one is divided to 4 parts. The middle constrictor muscles of the pharynx is divided in 2 parts, and inferior one also is divided to 2 parts. According to their origin, all these constrictor muscle of the pharynx, they are inserted to the connective tissue, which is called pharyngeal raphe. Pharyngeal raphe is in the midline. In next picture I'm going to show you. And superiorly is continue and is attaching to the pharyngeal tubercle in occipital bone that we studied in the skull section. So the four part of the superior constrictor muscles of the pharynx is here. The most superior part is originated from the medial plate of the pterygoid process here. The medial plate of the pterygoid process, and is attaching to the pharyngeal raphe, is called the pterygopharyngeal part. The second part is started from this raphe, which is called the buccopharyngeal raphe, or pterygopharyngeal or pterygomandibular raphe also is called. It's the border between the buccal region and pharyngeal region, and is attaching to the pharyngeal raphe. It's called buccopharyngeal part. The third part, it's starting from the mylohyoid line of the inner surface of the mandible. That's why, and is inserted to the pharyngeal raphe, is called the myelopharyngeal part. And finally, the fourth part of the superior constrictor muscles of the pharynx is started from the root of the tongue and is inserted to the pharyngeal raphe. So that's why it's called glossopharyngeal part of the superior constrictor muscle of the pharynx. So we have pterygo, bucco, myelo, and glossopharyngeal parts of there are the four parts of the superior constrictor pharyngeal muscle. Then the middle constrictor pharyngeal muscle, it has 2 parts, and as you see, it's originated from the hyoid bone. The place that is originated from the greater horn of the hyoid bone is called ceratopharyngeal, which is attaching, originated from the greater horn and is attaching and inserted to the pharyngeal raphe. And this part which is arising and originated from the lesser horn of the hyoid bone and is inserted to the pharyngeal raphe is called chondropharyngeal part of the middle constrictor pharyngeal muscle. So we have cerato and we have chondropharyngeal part of the middle constrictor pharyngeal muscle, according to its origin from greater horn and lesser horn respectively. And finally, the largest part of the constrictor pharyngeal, as you see here, is the inferior constrictor pharyngeal muscle, which is originated either from the thyroid cartilage or from the cricoid cartilage. And in this case, we have two parts of this muscle. This part that is arising from the thyroid cartilage and it's inserted to the pharyngeal raphe is called the thyropharyngeal part, and this part that is originated from the cricoid cartilage and is inserted to the pharyngeal raphe is called cricopharyngeal part of the inferior constrictor pharyngeal muscles. All the constrictor pharyngeal muscles, they are innervated by the generally by the pharyngeal plexus, which is composed of two nerves, the vagus nerve and glossopharyngeal nerve. So those are all about the constrictor pharyngeal muscles, and we are going to discuss about the elevator muscles of the pharynx. Regarding the elevators or levator muscles of the pharynx, here just for your for the summary, the superior, middle, and inferior constrictor muscles of the pharynx, and here is the pharyngeal raphe that in the midline it goes and is attaching up there to the pharyngeal tubercle. The upper part of the pharynx, it doesn't have muscles, as we mentioned. It is composed of just pharyngobasilar fascia. So, regarding the levators and elevators muscles of the pharynx, the first muscle is the stylopharyngeal muscle. Stylopharyngeal muscle, as you see here, is originated from the styloid process of the temporal bone and is inserted to the outer surface of the constrictor muscles of the pharynx here. The function is elevation of the pharynx. Then the other elevator is the salpingopharyngeal muscle. The salpingopharyngeal muscle, which is located a little bit medially from the stylopharyngeal, is this muscle is originated from the posterior part of the or posterior margin of the cartilaginous part of the eustachian tube and is inserted to the inner surface of the muscles of the pharynx, the constrictor muscles of the pharynx. And again, the function is elevation of the pharynx. The third elevator or levator muscles of the pharynx is palatopharyngeal muscle, which we discussed it already in the section of the oral cavity. As we mentioned, this palatopharyngeal muscle is making the posterior border of the palatine tonsile and is originated from the palatine aponeurosis of the soft palate and is inserted to the inner surface of the muscles of the constrictor muscles of the pharynx, and function is elevation of the pharynx, and in this case also is playing role for the narrowing of the isthmus faucium, which is in this picture, of course, is not seen. All the elevators or elevator muscles of the pharynx also, they are innervated by the pharyngeal plexus, which is glossopharyngeal nerve and vagus nerve. Be careful, in some literature you can see sometimes also the muscles of the pharynx, they write it that is innervated just by glossopharyngeal nerve alone, or in some of them is just by vagus nerve. But generally we say that they are innervated by the pharyngeal plexus, which is composed of glossopharyngeal nerve and vagus nerve. Regarding the function of the pharynx, at the end, the function of the pharynx, we classified them to three main groups. The pharynx is playing role in swallowing. The pharynx is playing role for respiration, it means breathing, and pharynx also playing role in phonation. So those are the main function of the pharynx. And in this picture is just I'm attracting your attention to the topographical anatomy of the space or the places around the pharynx. So if this is the posterior wall of the pharynx, and here is covered by the pharyngobasilar fascia, this green one, the space behind the pharynx, this space is called retropharyngeal space. That if you want to go the details of this space, here we have the not only retropharyngeal space, here is the dangerous space and also prevertebral space that in details topographical anatomy we are going to discuss. Also parallel to the pharynx we have this space which is called parapharyngeal space. This is called parapharyngeal space, and parapharyngeal space by the groups of the muscles that they are covered by the same fascia, they are called styloid septum. So here as you see stylopharyngeal, styloglossal, stylohyoid, posterior belly of digastric and sternocleidomastoid muscle. All this muscle is dividing the whole parapharyngeal space to the part which is in front of the styloid septum. It means this part is called peristyloid part of the parapharyngeal space, which contain the deepest part of the parotid gland, retromandibular vein inside, and external carotid artery. And here, which is neighborhood to the palatine tonsil, is called paratonsillar space here, which is belong to the peristyloid part of the parapharyngeal space. And the space which is behind this styloid septum, which is here and is called retrostyloid part of the parapharyngeal space. And the main component of this space is the component of the carotid sheath. It means that the dorsolateral internal jugular vein, ventromedially internal carotid artery or common carotid artery, depending on which level the section it will be. Posteriorly is the vagus nerve, and anteriorly it will be the hypoglossal nerve, and here near to the stylopharyngeus muscle is the glossopharyngeal nerve, and here near to the sternocleidomastoid muscle is the accessory nerve. Together in this area, which is the ascending pharyngeal artery, which is content of the retrostyloid part, and ascending palatine artery, which is the main blood supply for the palatine tonsil, which is not here, is drawn in these two artery, is located in the peristyloid. So ascending palatine is in the peristyloid part, and the ascending pharyngeal is in the retrostyloid part. So here is just a short recapitulation of the topographical relationship of the pharynx with the neighborhood structure and the spaces. So retropharyngeal and parapharyngeal, which is divided to the peristyloid and retrostyloid by the styloid septum. So this is the preparation and from the pharynx, and this is the view to the pharynx from the posterior side. So from the posterior side, if we look at the pharynx, this is the pharynx that we said that the superior or cranial part of the pharynx, it doesn't have any muscular fiber. Those are the pharyngobasilar fascia, which is cranially is attaching to the external cranial base that we already mentioned it, and it's called the pharyngeal fornix. And in the middle there is a pharyngeal raphe, which is superiorly is attaching to the pharyngeal tubercle. So in this picture, and here you can see the pharyngeal cavity. Here my pincet is inside the pharyngeal cavity, and in front of the pharyngeal cavity is the larynx. For example, here you can see the thyroid cartilage, the Adam's apple or laryngeal prominence, and here we are at the level of the vocal fold and vocal ligament or the gluteus, that this sagittal fissure that you can see. So posterior to that is the pharyngeal cavity. Here you can see, and in this region, as we said, superior part doesn't have the muscular fiber, and here they are starting the constrictor muscles of the pharynx that they are overlapping to each other. So the superior, the middle, and the part of the inferior constrictor pharyngeal muscles, they are located here. Among the elevator muscles of the pharynx, what I want to show you is this muscle. This is a styloid process, and from the styloid process to the lateral part of the constrictor muscles of the pharynx is attaching this muscle, which is called a stylopharyngeal muscle. This is the stylopharyngeal muscle, and as I already mentioned it, those are the muscles is a part of the styloid septum. The muscles of the styloid septum. This is posterior belly of the digastric, and this is the styloglossus, and then here is the stylohyoid muscle. The last video I was showing, and here you can see the parapharyngeal space that it's contained the retro styloid part of the parapharyngeal space, which is the laterally is the internal jugular vein, and medially is the internal carotid artery. Here it's the common carotid artery, and posterior to both of them, behind in the middle of them, or between of them, and the posterior is the vagus nerve that is passing here. It's very well seen all the structures that there are at the retrostyloid part of the parapharyngeal space, you can see. So here is, and now if I take the scalpel and I cut this pharynx and I open the pharynx, I will see this picture. This picture that you can see that the pharynx is cut. This is the cut edge of the pharynx, and now you can see the communication of the pharynx, and you can see better the different part of the pharynx. So this part of the pharynx that is communicating to the nasal cavity in this area is called nasopharynx, and this opening is called Juane, if you can see here. And here is the uvula, and in this case this is the oropharynx, and this is the place, and which is oropharynx is communicating to the oral cavity through the isthmus of Faucium, and here under that is the root of the tongue, and here is the laryngopharynx, and it has a relation with the laryngeal adytus. Here is the epiglottis, and here is the ariepiglottic fold, and here is the interarytenoid notch. So this is the area of the laryngopharynx. As I mentioned it before, in this area, lateral to the ariepiglottic fold and medial to the pharyngoepiglottic fold, in this area there is a recess which is called preformis recess, and here is the place that the foreign body it can trap here during to the swallowing, and beside that there is a fold which is a place for the passage of the internal branch of the superior laryngeal nerve, which is called laryngeal fold, or laryngeal the fold for the laryngeal nerve. So this is the structure. Once more, this is the posterior belly of the digastric, which is attaching to the mastoid notch, and here is the stylohyoid muscle, and here is the stylopharyngeal muscle from the styloid process, and styloglossus that it goes to the tongue region. So this is the posterior view when it's opened. In the next preparation, so I'm going to show you the nasopharynx. As we mentioned, the pharynx is divided to the nasopharynx, oropharynx, and laryngopharynx. Here, as you see, here is the nasal cavity, here is the Lehmann nasi, here is the nasal vestibule, and here is the nasal cavity proper, inferior, middle, and superior nasal concha. And here is the opening that the nasal cavity is communicating with the nasopharynx. So here is the nasopharynx, which is important, and here this opening that you can see, and my pincet is inside, is the pharyngeal ostium of the auditory tube or eustachian tube. Here we said it that is equalizing the pressure between the atmosphere and middle ear. It's important, and immediately above that there is an elevation, and posterior to that there is an elevation which is called torus tubarius. So here it's the place for the cartilaginous part of the auditory tube or eustachian tube. In superior surface, in this area, there is a pharyngeal tonsil, as we mentioned it. It's the part of the Valdier ring or tonsillar ring, and in children is so big and large, and sometimes it's making a problem with the closure of the respiratory pathway. So that's why it needed to be operated, and usually these children, because of the enlargement of the pharyngeal tonsil that is closing the Juane and respiratory pathway, they are breathing by the mouth, that it's much more prone to the infection. So breathing through the nose is much more better than through the mouth. So that's why it's here, the pharyngeal tonsil, it will be operated and it removed, and the breathing, it will be complete. So usually this pharyngeal tonsil in this area, it will be becoming smaller and smaller from the age of the 10 years old, and then finally it will be a remnant of this pharyngeal tonsil. Here, as we said, that is the region of the torus tubarius. At this part you can see another aggregation of the lymphatic tissue, which is called tubal tonsil. This is other part of the Valdier ring, together with the lingual tonsil and palatine tonsil and pharyngeal tonsil. So here all about the nasopharynx, and if you want to look at it, the Juane once more, so I can show you in this. This is the orbit. This is the frontal sinus, and this is the anterior part of the nasal cavity, and posterior side of the nasal cavity is this opening, which is called Juane. This septum that is dividing the Juane to the right and left is vomer, and here it's the area of the nasopharynx. This is the frontal section through the skull. And here in this area, this is the uvula, which is, once more, here is the hard palate, continuing with the soft palate, and this is hanging of the uvula, and here is the epiglottis, and here is the vallecula epiglottica. So here is the oral cavity proper, that the tongue is located. So communication with the pharynx. So here it was the nasopharynx, and here we continue with the oropharynx. And oropharynx is communicating with the oral cavity proper here in this opening, which is called isthmus of Faucium. And this is the place of the communication of the oral cavity with the oropharynx. And here, finally, it's the epiglottis, and here is the entrance to the larynx, and here this area is the laryngopharynx, that in this next preparation it's much more better seen. So if you look at this preparation, here is the wall of the pharynx, as you see. Here is the nasal cavity, and here my pincer now is inside to the nasal cavity through the opening, which is called Juane. Here is the Juane, or sometimes they call it Shuana also, but Juane, I like it. So here is the nasopharynx again. As you see, here is the opening of the eustachian tube, the pharyngeal opening of the eustachian tube. Here is the torus tubarius here, with the pharyngeal tonsil here and tubal tonsil here. Then again, here is the uvula, here is the epiglottis, and here is the oral cavity proper, and here the opening that it's is communicating with the oropharynx here. So this is the isthmus faucium, and here is the oropharynx. And then if I continue to the pharynx here, you can see the area of the thyroid cartilage and cricoid cartilage here that is finishing. So here is the laryngopharynx, and here is the entrance to the larynx. So this is epiglottis, for example. So in this level, which is the cricoid cartilage, the pharynx is finishing, and from this level is starting the esophagus. And here is the trachea. This is the level that the larynx also is finishing, and the trachea is starting also, it's at the level of C6. After the pharynx, next part of the gastrointestinal tract is esophagus. Esophagus, as we mentioned, is started at the place that the pharynx is finishing, which is at the level of the cricoid cartilage, which is at the level of C6. So from here, the esophagus is starting, and it passing through the neck region, that it enters to the superior thoracic aperture, entering to the thoracic part, and then is perforating the diaphragm through the esophageal hiatus, and it enters to the abdomen, and finally it's finishing to the and it open to the stomach at the orifice, which is called cardiac ostium, at the level of T11. So it means that origin of the beginning of the esophagus is at the level of C6, cricoid cartilage, and the end of the esophagus is at the level of T11, at the level of the cardiac ostium. The length of the esophagus is approximately 25 centimeter on average, and as we mentioned, the diameter of the esophagus is 1.5 centimeter in the case of the swallowing, and the passage of the food, it can be 2 times becoming bigger than 1.5 centimeters. So as I mentioned, during its pathway, it has 3 parts. The neck part of the esophagus, which is called cervical part, then the thoracic part of the esophagus, which is called thoracic part, and the abdominal part of the esophagus, which is called abdominal part. The cervical part is approximately 6 centimeter. The thoracic part, which is the longest part, is approximately 16 till 20 centimeter, and finally the abdominal part, which is the shortest part, is approximately 1 till 2 centimeter. Regarding the cervical part, the esophagus is originated at the level of C6. We said it's passing immediately behind the trachea, in the region that we said is called parius membranosa, or the membranous part of the trachea, and exactly passing in the midline behind the trachea down. Between the trachea and esophagus, there is a fissure which is passing in both sides the recurrent laryngeal nerve, which is branch of vagus nerve. As we mentioned it before, it's in the left side is turning around the arch of aorta, and the right side this nerve is turning around the subclavian artery, the right side. So, but both of them, it's passing between the trachea and esophagus upward, and is innervating the sensitive innervation of the lower part of the larynx below the vocal cord, and also is innervating the motoric innervation of the muscles of the larynx, all the muscles except the cricothyroid muscle, which is innervated by the superior laryngeal nerve, the external branch. So esophagus then is passing through the superior thoracic aperture. It's entering to the thoracic cavity, the passage is located inside the posterior mediastinum. It's continue behind the esophagus till the level of T4, which is the level of the bifurcation of the trachea, which is dividing to the right and left main bronchus. At the level of the T3, the beginning of the thoracic aorta or descending aorta, it's coming over the esophagus also, and then as you see, the aorta, it's located on the left side of the esophagus, and finally down, it's coming near to the midline. So in the thoracic part, as you see the esophagus first, it's a little bit turning to the left side, then it's coming to the right side a little bit, and then at the abdominal part again is turning to the left side. So we divide them to this pathway, to the upper part toward the left side, middle part toward the right side, and lower part toward the left side again. Here then the esophagus, it's perforating the diaphragm or passing through the diaphragm through the esophageal hiatus together with the vagus nerve. As we mentioned, the vagus nerve, the right vagus nerve, it's going behind the esophagus, and the left vagus vein, it's going in front of the esophagus. Then they make the anterior and posterior vagal trunk, and the vagus nerve together with the esophagus, they are passing through the esophageal hiatus, and they are entering to the abdominal cavity. Here in this region, when it is passing through the esophageal hiatus, it's working like a sphincter, and that's why it's preventing the reflux of the content of the stomach back to the esophagus. So this part, which is playing role as a sphincter, is very important for the patient, for the people, and if there are some dysfunction of this sphincter part or this part of the diaphragm, so then it causes that the acidic, very high acidic content of the stomach, it's going to the esophagus, and it causes a very severe pain in the thoracic cavity, which is called heartburn, and it can be misdiagnosed by with the myocardial infarction, because the pain is in the chest, and it's because of the sudden entrance of the content of the stomach to the esophagus. So regarding to the abdominal part of the esophagus, is 1 till 2 centimeter, is the shortest part, as we mentioned it, and finally the esophagus is entered to the stomach, to the place which is called the cardiac ostium, and the rest, the content, it will be inside the stomach, that it will be discussed. So here you can say about this structure that I said is working as a sphincter, and if this sphincter or the esophageal hiatus at the diaphragm, it doesn't work, so it makes this heartburn or reflux of the content of the stomach back to the stomach, which is the mucous membrane is not prepared for this acidic environment, because the different of the epithel. So epithel of the esophagus in this whole area, it's squamous epithel, but the epithelium of the stomach is the cylindrical epithel, and always remember that when the place that is one epithel is changing to the other epithel, there is a high risk of the formation of the dysplasia, or later the cancer. It can happen because of the two different epithelium in the border of two to a structure. So during and at the end also the outermost layer of the esophagus is for the cervical part and thoracic part is covered by the adventitia, but the abdominal part, because it's entering to the peritoneal cavity, so it's covered by the serous fascia. This is the difference. And finally also it's very important about the musculature or the muscular layer of the esophagus. Usually we divide them to the three parts: the upper third, the middle third, and lower third part of the esophagus. The upper third is more or less more skeletal muscles, so it means that is under your control and is voluntary. The middle third is mixed muscle of the smooth muscle and skeletal muscle. It means that you control it, not 100%. And finally the lower third, which is absolutely is a smooth muscle and is not under your control. Esophagus during its pathway, it has four sometimes physiological narrowing place, or they call it constrictor place of the esophagus, because in this three place the esophagus is becoming much more narrower, so that's why they call it narrowing place or constrictor place of the esophagus. The first one is located in the cervical part, and it's immediately beginning of the esophagus at the level of the cricoid cartilage at the level of C6. It's the first physiological narrowing place of the esophagus. Then it is not that much constant. The second one is not that much constant. It's the where the esophagus is crossed by the arch of aorta in the left side. So when the arch of aorta passed from the left side in front of the esophagus, so here we have a narrowing place, which is the not constant place. The other one that is more constant. It's when the esophagus is crossed by the left main bronchus, which is passed in front of the esophagus and is crossed. And finally, the last one is when the esophagus passed through the esophageal hiatus of the diaphragm. This narrowing place is clinically very important, because during the endoscopy examination, when the endoscopic tube is going inside the esophagus, this narrowing place, it can be damaged by this endoscopic camera, and it can cause the ruptures of this part of the narrowing or constrictor place of the esophagus. So that's why the doctor must pay attention especially to this narrowing place of the esophagus, approximately from the upper central incisors till to this cricoid, the first narrowing place, which is the C6, approximately is 14 till 15 centimeter, till to the arch of aorta narrowing. Behind the arch of aorta approximately is 22.5 centimeter. The narrowing place at the region of the left main bronchus, it's approximately 27.5 centimeter. And finally the narrowing place that is passing through the diaphragm from the central incisor, that the camera is entered to the oral cavity till here, is approximately 40 centimeter. Regarding the topographical relation, we said that the pathway of the esophagus here between the esophagus in the lower part of the thoracic cavity, when the aorta is going behind the esophagus, between the esophagus and aorta in the right side, and also the azygos vein also is located in the right side. Between the aorta and esophagus, left to the azygous vein, you can find the thoracic duct, which is entering through the aortic hiatus, and it's going to the posterior mediastinum as well. Here in the right side also, the adventitia, which is covering the posterior part of the esophagus, it can be find some recess of the mediastinal pleura of the right lung, which is called the retroesophageal recessus. So those are all important information about the esophagus. So regarding the esophagus, for your orientation, here we have the Adam's apple. This is the laryngeal prominence, and here is the cricoid cartilage, so at the level of C6. It means that here is the larynx, and here larynx is finishing, and here is the trachea, which is here is cut. Behind the trachea is esophagus, and it means that here is the pharynx behind the larynx, and again at the level of the cricoid cartilage, here as you see the pharynx is finishing and the esophagus is originated. The esophagus is going in the cervical part behind the trachea, in the place which is the ring of the trachea is open. Here is called the membranous part, and in this place exactly in the midline it passing the esophagus. Then esophagus is entered to the superior thoracic aperture, and it entered to the thoracic cavity in the posterior mediastinum. Here is superior mediastinum that you can see the brachiocephalic vein, the left side and the right side, which are making the superior vena cava. Here in front of them it was the remnant of the thymus or the thymus. Then after the venous layer, it's the arterial layer. This is the ascending aorta, and here is the brachiocephalic trunk that is divided to the common carotid artery, the right side, and the subclavian artery. And here is the arterial layer, and then the trachea, which is here is cutted. So here it's the esophagus that is entered to the thorax, and it's going downward toward the diaphragm, and finally it's perforating the diaphragm in this region, and it's 1 or 2 centimeter course of the abdominal part of the esophagus, which is entered to the stomach. That in the next video I'm going to discuss about this. So this is the esophageal hiatus, that it passed the esophagus and vagus nerve, that they are parallel with the esophagus in anterior and posterior wall. It's passing through the right vagus, it goes posteriorly, and left vagus, it goes anteriorly. They make the posterior and anterior vagal trunk. And here is the diaphragm. So the course of the esophagus, as we mentioned it, it's important. Here is the thyroid gland. If I remove it, so here is the cricoid cartilage. So the first narrowing place here, it was the C6 level, that is the first constrictor place. This is the arch of aorta, as you see, and here is the beginning of the thoracic aorta that is going here. It's the place that the arch of aorta is going over the esophagus. It's the another narrowing place, and also the place that the left bronchus is crossing the esophagus, because trachea is here is cutted, so I don't have it. So it's another narrowing place. As you see, the thoracic aorta, then it goes on the left side of the esophagus and behind the esophagus, and at the lower part the esophagus is a little bit turning in the abdominal part toward the left side also, and finally is here is coming through the diaphragm as a esophageal hiatus, and is entered to the cardiac ostium. So this is the course of the mediastinum in the posterior course of the esophagus in the posterior mediastinum. Here between the esophagus and the aorta, in this area on the right side is passing of the thoracic duct, and on the right side here is the passage of the azygos vein. So this is topographical relation. In next preparation, I'm going to show you the relation of the left main bronchus to the esophagus. Okay, here is the course of the esophagus that you can see it here in the posterior mediastinum. This is view from the left side. So this is the continuation of the arch of aorta that is going toward the left side, and here is continue as a descending aorta, as a thoracic aorta here. And as we mentioned it's the arch of aorta here behind, it's going in front of the trachea and in front of the esophagus. Here is one narrowing place, and here at the level of T4, the trachea is divided to the left and right bronchus. This is the left main bronchus, and here the left main bronchus anteriorly is crossing over the esophagus. Here is the esophagus, and that's why in this place there is a narrowing place which is approximately 27.5 centimeter from incisor, central incisor. It's the place of the narrowing place, which is for endoscopy it's important. And of course the esophagus is going down to the mediastinum, and as already we mentioned, it is perforating the diaphragm and is entering to the abdomen and continue as an abdominal part of the esophagus. Dear students, that's all about the second part of the gastrointestinal tract. I hope you like this video and it will be useful for your studies. I would like to thank my colleague Dr. Petrashek for his help, and I wish you to be safe and healthy, study hard and stay safe. Thank you for your attention.